Good
All
Friday
right.
morning, everyone. Sorry, BJ, you're probably about to say the exact same thing. Good morning. We'll let people get in here into the Zoom room and then we will get started.
Hmm.
And actually, BJ, if you want to just, introduction and we can go through the how-tos,
Yeah,
we can get into it. That'd be perfect.
sure. Okay. Hello, everybody. Um, Welcome back or welcome in the first place. These are just a little quick level set. And so today, as ever, we start with some slides. We will kind of level set, throw some notions out there for everyone to respond to and kind of get us in the ballpark together. And then we'll cut to you all for conversation, questions, comments, stories, anything. And just a reminder or for new folks, this is what we would call a safe space. So it should be safe to think or feel or say just about anything. I think within the boundaries of basic kindness and mutual respect for yourself and others, that's about the only rule here. Um, so no need to participate, but we'd love when folks do, so don't hold back. Um, I'll cut to Sonia in a second here, but real quick, you all probably recognize Natalie Crittendon, one of our dear friends and counselors here at Metal. And I don't know all the adjectives for you, Natalie. The work you do, besides the work you do, which as an occupational therapist in palliative care is by itself a very rare thing, a very rare and wonderful thing. We get to see you in action. And then there's you as a person, which just you bring so much to this work, so much thoughtfulness and so much kindness and sensitivity to this work. It's so beautiful and fun to work with you. So thank you for being here. Um, so while we'll leave you blushing, and then Stones, you want to do our little housekeeping stuff?
Yes. So Natalie and BJ will go through some slides like he mentioned, and then after that, the best part of these for us is taking your questions and comments and hearing your thoughts. So you can do that in a couple ways. You can raise your hand and we'll unmute you and you can chat with Natalie and BJ, or if you prefer not to do that, you can type it into the Q&A and I will read it aloud for you. The chat is also open, so if you have just a thought that comes along with anyone else mentioning anything or anything that's being said, please feel free to put it in there for everyone to read. And thank you again for being here.
Thank you, Stones. I'm sorry if there's some background noise here, folks. I'm in a funny location. So please bear with me. Or Natalie or Sonia, make some sort of gesture if there's just too much noise, and I'll figure something out here.
Okay.
All right. Well, Natalie,
Yes.
take it away. All right. Well, we'll back and forth this a little bit, but I would love to hear from you to start.
I'd be happy to. Thanks, BJ. I mean, we really could just leave this slide up for a moment. We could all read it. We could move on to the next one.
Hmm.
Right? It is exactly what it says, where there is not separation is another way. There is not a separation between the mind and the body. And I thought about us having this conversation today because I have been limping around for 2 weeks now with a hurt foot. And it turns out that I have tendonitis. And I was thinking about how nervous my foot, ankle, gait, everything around my physical being is nervous right now. And then I've noticed that more recently I have felt nervous in my daily life, where there's this anxiety around a part of my body that is carried over into my daily life. So I actually want to invite us all that are here together. While I know you and I are chatting, BJ, know you all are here, whether in this on this exact day and time or another day and time, to take a minute to think about when there was the presence of anger or anxiety or weeping in our body, and at which point then in our mind we became angry or anxious or saddened. And if we can all just take a moment to think about a time in our lives that surely is there when our body was angry and then we were very, very angry outwardly, or weeping, or filled with trepidation to the point of having very, very involved anxiety, and noticing how that connection does absolutely exist.
Yeah, I'm with you, Natalie. I mean, it's a funny thing to say that yes, there is a mind-body connection. To your point, I think we're realizing they are inseparable. Not that there's a connection, but these things can't be separated without fallout. So as you're talking, I'm thinking of my own experiences with discomforts of various kinds and how I try to compartmentalize and crowd out the emotions, and I do all this engineering work to disconnect my mind and body, or mind over body is a thing I kind of grew up around, with our attitudes or various things that we can conquer our bodies or have dominion over them in some weird way. And while that may be true on some level, in some short-term way, I think I've come to realize in my own life and working with others that comes at some great cost. That and ultimately to land at, this is good news. I don't want to hide. It's beautiful that our bodies would reveal our thoughts and feelings and vice versa, and that they're all in some swirl together. Unless you're interested in hiding, and sometimes I am, but for the most part, I think I've come to see this as sort of gorgeous. I don't want to fake it, can't fake it, but not for very long anyway. So yeah,
It'll take us down. It'll exhaust us. It'll bring us to complete exhaustion. Trying to delineate and divide our system will drive us to exhaustion, which absolutely can bring along anger, anxiety, depression with it. The separation will take us down.
well, with that,
On that cheery note,
and then we I mean, and the upshot and the other, just to place, I mean, and reconnecting them can take us up, so there is, this all goes in all directions.
yes, yes. So this is a different order than we had talked about. So I'm wondering, BJ, would you mind going to the nature of trauma? Yeah. Thank you. Okay, so BJ and I were talking beforehand, and he kept on saying, Natalie, we just have to talk about trauma. We have to. And I was like, no, BJ, because everyone starts to panic and they say, no, I haven't experienced trauma. And people just check out. And I have all these biases around naming the word trauma and bringing it to the table, even though my entire career has been rooted in working with folks actively experiencing trauma and having a long history of having experienced trauma. So it's quite comical, actually, that I'm like, no, because what I don't, I want to kind of think about what BJ was even saying earlier, what you were saying, BJ, around orchestration and like, how can I navigate and control any of this? And I can't. So if any of us are thinking, oh, this isn't me, I haven't experienced trauma, that's not the case, just noticing like that's coming up for me. I don't associate with having experienced any trauma. And there's so many different ways to define trauma, but actually one of my teachers would always talk about the component of something being unexpected. And so when I think about just really distilling the nature of trauma, I will always think about something that was unexpected. And then I very quickly think about the sympathetic nervous system coming online. So there's the parasympathetic nervous system, which is rest, digest, The sympathetic nervous system, we know it's engaged by these responses: fight, flight, freeze, and fawn. Fawn is maybe a newer one for folks to think about, to consider, and it can include if someone has a perpetrator, someone that is involved in a traumatic situation where, oh, I love your hair today, and fawning over, oh, what you did for me was so amazing, you're so delightful. And the response is around kind of wooing this person into a place where then the person that is experiencing trauma can access some feelings of safety. So I think about unexpected and then very quickly moving to these nervous system responses, which we all have because all animals have them. All animals have them. And that's the thing, is that our cognition goes offline, and then we're just accessing one of these responses, pinging between all of them really quickly, just going for one really hardcore. It can look really, really different for all of us, really different and very nuanced. And there's nothing wrong with it. And we'll talk more about that. I will often say to people, this is great. We know your nervous system is intact, working well, and trying so hard to protect you.
Mm-hmm.
And we all had this collective trauma of the pandemic, even, right? So we all know that actually we have experienced trauma. We can now say that across the board because of this collective trauma. And I would argue that there are many collective traumas in the same period of time and that we continue to live in. But really, I think when you and I thought through this, BJ, is around really being able to name that a trauma response lands us in this nervous system response.
Yeah, and as you said, just to really highlight it, these are not under our control. These are reflexes, and that means it's not up to us. It's not there's not much of a choice, and that's really important to note for a number of reasons. Just so we can understand ourselves, but so we can understand each other. I think as we learn more and more about trauma, to your point, Natalie, it's everywhere. It's historical. There are layers. There's so much that qualifies as trauma, especially once you democratize it to see something that's simply just sort of unexpected in a big way to your body, to your person. And so one of the reasons to note is this reflexiveness is our innocence before our reactions. To your point, actually, that is a sign that our nervous system is intact and is functioning. But if we're also, it can help us read each other. So if we're talking with someone who has experienced some amount of trauma, and we trip into a subject that rings bells for that person, we might see them act really angry, or get combative, or take off, or do the fight, flight, freeze, fawn thing, and then we might judge that person as, oh, what a jerk, he's so angry, right? Then we've accidentally further isolated ourselves and each other when we're really in the need for some amount of compassion and understanding. So if we don't know how to read these signals, it's very easy to accidentally make things even worse for each other. And then one other thing to say as you're bringing it up, I get why you didn't want to necessarily open up big conversation around trauma, but let's just take a moment, like I think you already did this, but just want to harp on it for a second. I think a lot of us think of this word trauma as it goes with something monumental, murder, assault. This is, I think a lot of us grew up with, that was trauma. And so we don't think of ourselves as qualifying as having had trauma. So I just want to cut back to your definition, Natalie. It's sort of basically anything that's unexpected. There can be big and little traumas, but they can all have a similar response on our nervous system. So we're all kind of invited to this party, for better and worse. Yeah.
And I do want to also name that we will continue down this path. And so I wanted to really give fair warning to folks that are listening or watching that we will just continue to dive in this direction. So to really take care of yourself, if you need to pause, walk away, go, later on, check things out, just as a signal that and honoring that this could be activating for folks. So we will be continuing on this pathway and on this theme.
Yeah, thank you, Natalie. All right, my friend, let's see if which slide do we?
Let's go to medical trauma after that. This is like a fun
You mean this one?
Jeopardy. No. Go to the one that's
No.
medical trauma and has brain scans on it.
Oh yeah, there you go.
Yeah.
Okay, thank you, Natalie. Sorry, I don't know how I did that.
Oh, good. So those of us that access the healthcare system for ourselves or with loved ones or as a caregiver in any realm, and I would also argue those of us that work in it, when any of the things that we were just describing in terms of unexpected events that land us in a nervous system response, that very often can occur when we are accessing healthcare. And then it gets really nuanced and confusing because then we need to return. We need to return often to the same people in the same place. And that is not highly recommended in terms of supporting folks that have experienced trauma, is to return. And so many of us need to return over and over and over and over again. And so when we return, whenever we go towards a scene of trauma, it is very healthy and typical and normal for our sympathetic nervous system to go, I got you. And here we are. And we are ready to fight, flight, freeze, and fawn. Ready. That is the job of our nervous system when we are returning to a site where trauma has occurred, with people, with the smell, with people wearing similar clothes, with certain type of gear, certain metal, the sounds, the lights, all of it. And off we go. So I really want us to be able, for both BG and I, to sit here and say, it's real, it's alive, it's happening for a reason, and it's very typical.
Yeah, there are stats out there. I'd love to find some data eventually on this, but it's particularly true, you can imagine, in emergency departments and ICU settings, and we're getting clearer and clearer on this fallout and how long it lasts. And it's not just for the patient, as so much happens in these situations happens not to just me as an autonomous patient person, but people close to me. So families can experience this. It's not uncommon in ICU stays for families to experience some amount of trauma. So it is very real. I mean, on a small scale, a lot of you may have heard of the white coat syndrome. Just the trigger of seeing someone in a white coat triggers a sort of I'm in a doctor's office, and all sorts of things can go with that, and blood pressure can shoot up. I mean, it's a very common, a simple version of this that we see commonly in a doctor's office. It's white coat syndrome. And it can happen driving by the hospital, or like you say, Natalie, a smell that maybe an astringent or a chemical that was used in one hospital, you smell it in some other place, and it can bring you back immediately. Again, there's no choice here, or there's little choice here. I suppose over time, I'd be curious, where do we have agency to segue this response, to move it over time? That's a sort of another conversation, perhaps. But in terms of the response, again, a reminder, we're innocent. These are reactions that we don't get to control.
And I would go up against you a little bit, BJ, because you even named the medical trauma being ICU and the emergency department, right? Whereas we were just, BJ highlighted that trauma is not murders, car accident, that it's not solely in that capacity.
Yes.
It's not solely in the emergency department and ICU. It is the routine checkup, right?
Yes.
It is taking your child to get a vaccination. all of those are within the realm of possibilities, just like together, BJ and I came up with the entire realm of what it is to what capacities are included in experiencing trauma.
Yes, thank you, Natalie. I only meant to say we might think of it in these very dramatic settings, but it's not limited there is what I meant to get across. But thank you. Right on.
Yeah.
It's a very important distinction. All right, my friend, let's see. Where do we want to go next?
Let's go to some stories.
Let's see. No. Well, no.
Other direction.
There we go.
Yes.
Hmm.
What do you think, BJ? Do you want me to start?
Yeah, that would be good.
So BJ and I thought about each of us having lived experiences, like surely so many people listening, about the connection between the mind and the body. And for me, I think a lot about how at 16, my pain after an open heart surgery was not well managed. And I was feeling like people were not listening to me. They were not listening and they were not responsive. They were not clearly getting my communications, which were through using a dry erase board and a pen and waving my arms. Was unable to speak, but I was not being heard. People were not orienting to my reality and then responding accordingly. So now when I go to see doctors in certain buildings, I go in and I can notice this process. I go through the sliding doors. I start to smell and hear and see everything. Immediately, I just start to numb out. I just kind of exit my body. So I do a flight response. So I start to just flee. So part of me is just gone. You can see my face. I just become a bit of a ghost. I feel numb. I'm not really in my body. So I just like kind of start this surrender process. And then once I start interacting with healthcare professionals, I'll remind you, I am a healthcare professional, but I am now back in the place and my body starts to retell this whole story when I'm 16. And then every healthcare professional that comes and does anything with me or has any conversation, I am ready to fight like hell with them. Like my life depends on it. And I am immediately ready to just go at it with them. And then I dip into like fawning a little bit. I like fawn for a moment or two, and then I just go back to fighting because the 16-year-old in me comes alive. That response says they aren't going to listen. They aren't listening. They are not listening. They're not responding. They're not orienting to reality over and over and over and over and over again. So then I just start to fight. And it doesn't matter what the topic is, what they're trying to say. I will find a way. They're doing something wrong. They're screwing it up. They could just be telling me something and they're doing it in the wrong way. And I just become enraged. So I just watch myself pinging between, I go from flight to fight to fawn. And then ultimately at some point I get so tired that I just freeze.
Whee!
We
Right. Yeah. Oh, mama. Yeah. I was thinking personally, well, a question for you, Natalie. Knowing how this works to some degree and knowing yourself so well, has that response evolved with time, or is it just the same old, just like it was yesterday, always?
The response is my system is pretty adamant. It is pretty adamant. You know, going on, I don't know, 30 years later, it is pretty stuck on taking good care of me. So my system hasn't changed a whole lot. What has really, really evolved is some ways, which we'll talk about a little bit later, that I have looped in a lot of support and care and some ways to take care of myself in the midst of my nervous system really saying, I got this. I'm going to handle this, Natalie. Let me just take care of you.
That is such a beautiful reframe. Folks out there, did you hear Natalie do that? Take what a lot of us might figure feels like an uncomfortable response or something not wanted and reframe it as your body taking care of yourself. Nice work, my friend. Thanks for modeling that. That is not a small little inflection you just did there, and it makes a huge difference. Yeah, I mean, I think we all live with all sorts of stories, you know. For me, a couple of ones that come up in my recent experience, I think some of you may have known, I had a bunch in the first 3 years of Metal's existence, I had a bunch of surgeries on my leg. It's all such a weird, it was just a very strange experience. Lasted total for about 3 years, and I had 4 surgeries on my leg, 2 of which it turns out were unnecessary. It was a missed call on an X-ray. Very simple, you know, um, and a very simple mistake. But the way the mistake was handled in our dear old medical system was where the trauma layered in. No one owned it. No one even acknowledged it. Complete gaslighting. And I'm a physician, and this was at the institution I have long taught at and was a faculty member at for years. I probably taught some of the doctors who were treating me. And I could not believe the sort of emotionless response that came towards me, and nor could I believe my own response to their response. It shut me down in a huge way. It made me second guess everything I was thinking. It made me second guess myself, my injury. I mean, it really threw me for a loop. It really shut me down. And I remember being in one of the visits with one of the surgeons, and I just couldn't believe what I was hearing, or really what I wasn't hearing from him. And I managed to get out some sort of, you know, register some displeasure with their response. But for the most part, I was shut down and didn't do much. And then felt terrible for feeling like it felt like such a weak, it felt so like a weak-hearted, didn't stand up for myself, or, you know, all sorts of stuff crept in. It felt terrible. And I just could not believe I was still so vulnerable in this way, given my own experience with this, my accident and the healthcare system, et cetera. But it didn't matter. I was not immune. None of us is immune. These are, to your point, these are human bodies taking care of themselves. Certainly didn't feel that way. I didn't feel like I was taking care of myself. I really, boy, it threw me in all sorts of ways. But that was part of the narrative. I took it on myself. It wasn't somehow I screwed up by them missing this call. Weird gymnastics. If I could only have seen, I should have talked to you, Natalie. If I could have only had seen that was me taking care of me, it would have really helped. But that's recent. This was like a year or two ago. So that's a harder story. But you know, again, I want to kind of open up the sluices in both directions here. You know, another example of this connection, I remember when I was in the burn unit 33 years ago, I had a couple nurses with whom I was very close. And one of them, Joy Farcardapone, wore a certain perfume. And she was so loving and caring. And so now if I walk past someone who's wearing that perfume, I immediately have this nurtured, feel held, loved, nurtured, something really good. And it's 33 years down the road. It's just a simple scent. So there's sort of a different kind of emotional valence with that story, certainly anti-traumatic in a sense. But anyway, there's a couple stories for you. I'm sure everyone listening has their own, probably plenty of stories in this mix. Well, now where do you want to go next, my love?
Let's go to the separation.
This
Yes.
one?
Yes. So I had a visit with a provider who I really feel very seen and held by and taken care of by. And so I share this story really from my heart as a provider and them as a provider, and the longing that I know that we've touched on a little bit around, if we could just disconnect, oh my gosh, what a treat, this notion, this idea that if we are separate, then great, we have less suffering. If we could do it, ultimately it'd be better. BJ and I have a similar perspective, and the argument of that when we can reckon with that there is the interconnectedness, that actually there is a possibility to feel more whole. And when meeting with this provider, they said something along the lines of, well, here we are together. This is what we do every 6 months or every year. And so if the rest of the year you can just act like this isn't a thing, then you get your life, right? And I was struck by, in a bit of what you were just speaking to, BJ, that I'm doing something wrong. That, gosh, I think about it a lot. If I could just be better and ignore it, oh, I could have my life. Which leads me to this notion that exists in so many realms in so many ways. I'm not saying that this is only in this situation. As healthcare providers, but even more so, the system that trains us healthcare providers and to administer healthcare in this way in the United States, what can happen is that the provider, their perspective can come from, and how we are trained and how it's upheld at the clip in which we're all running, is my comfort is more important than your reality. So I can feel comforted if I know that you can separate. And so the system itself needs to perpetuate this narrative, because then the system itself can continue to run the way it's running, at the pace it's running, the way in which it's evolving, that BJ, you don't have a provider that comes in and says, this is what happened, I screwed up, I am really sorry. Because that would be an acknowledgement that the body and mind are connected and that there isn't actually a separation. And so I share my story because I imagine I'm not the only one that has been told. Please think about this cognitively. If you could just limit it to that, then we can continue this conversation and I can get through all the information that you need and the points. But how are we to get online and access our cognition? There's been enough studies out there. There's enough research to know humans cannot learn when they are in a trauma response. And so I argue, when we access the healthcare system, many of us are in a trauma response, which is being totally activated by our sympathetic nervous system, which is, again, not a fault. It is our system taking care of us. And I cannot hear what you are saying, retain anything, or consider your perspective. We actually know this from research. When we're in a trauma response, there is no ability, or I should say there's a lack of ability, to do any perspective taking, which is what I need to do, because I need to hear what the doctor is saying. From my perspective, here's what's going to happen. But I'm over here just ready to fight you. So we are upholding the system where there's the lack of integration, and then I actually am not able to access this incredible healthcare in these brilliant minds.
Hey, man, that's beautifully summarized. And by the way, of course, this doesn't work ultimately for the providers trying to insist on this separation, because they, it turns out, are humans too. And this enters the demoralization of working in these systems also too. There's a lot of fallout from what you just described so accurately. And I think, I'm hoping, this is to kind of go back historically. Healthcare has separated mind and body, but Western thought has since Descartes, 1700s, I think, maybe even 17th century. We go back, this is sort of European philosophy, Enlightenment era, where I think therefore I am was the famous Rene Descartes phrase that sort of set us down this path, that we are separate. There's objectively, there's you over there, there's me over here. Two different things. I think that's what makes me, that's what helps me, that's why I exist. That is my existence. I exist because I think, because I cogitate. And we've lived now, whatever, 300 plus years with the fallout of this thinking, which has allowed for a lot of that separation, that isolation. Like the medical model has produced amazing research, often at the expense of the researcher, but sometimes it can land this sort of hyper separated, focused world can produce all sorts of interesting stuff, but at great cost. And I think so, yes, as a convention, separating mind and body got us somewhere to some degree, but it also has a lot of fallout. And I think we're now increasingly understanding this. This is a conversation we couldn't have had, at least not in Western dogma, even 20 years ago. I think we might have, but it would not have been accepted as such. So this is shifting, and I think, like a lot of systems, healthcare, it's going to take a while for them to get the memo. But all the research, all the training, everything, the body of knowledge of how medicine understands itself is really grew up in the heyday of the separation of mind and body. So it's going to take a minute. It is a product of that separation, to your point, Natalie. But again, I do want to make the point here: this is Western philosophical thought, and it's all over society. It's it's not just in healthcare. Okay. All right, my friend, where do we want to go next?
The positive, think positive, the pink. Yeah. We didn't got to stay long on this, but we felt a sense of responsibility, the team being Sonia, BJ, and I, and putting our heads together, that this had to be named. And there's a thread back to, if a provider tells me just to ignore my health situation for the remainder of the year, right? That's a spin on think positive. And I'm sure so many of us, someone recently told me that something horrific happened to their child, and someone said, well, at least it wasn't, they're lucky it wasn't. And the parent so quickly, inspiringly said, I actually disagree. I don't think there was anything lucky about what happened. Right? There was nothing lucky. And in terms of think positive, once we at mental health feel strongly about, we're going to say something that happens so that, to BJ, your point, we might have the opportunity to feel less alone in it. So any of us that have been told think positive, I will again reference back to my comfort is more important than your reality. And if some human can say, think positive, you're going to think positive, you're going to go forward and think positive, I'm able to maintain some level of comfort. And I need to hold on to that. There's so many reasons why. And right now in this moment, that might be more important than your reality. And I'm sorry that that happens.
Yeah, that's beautifully put. I mean, I don't know that we need to belabor this one too much. We can get to the chat sooner than later, but yeah, I'm with you, Natalie. We'll just leave it at that.
Yep. And that's just to name also, that's active, that if that activates a trauma response, that is okay, right? I want to name that can be an activation of a trauma response, which is getting your nervous system online and pinging. Okay.
Thank you.
Yes.
Right on. Okay.
Okay. So we're on to the last one. Very, very last one. We're going to do some level setting. Because some people might be saying, okay, great, Natalie and BJ. Awesome. So all of this, and I referenced it in my story. Okay. So now what? Right. But I want to say before we start talking about this, the slide disappeared, BJ.
Oh, sorry. Is it back?
It's back now, at least
Sorry.
for me. When we talk about, okay, so what do we do? Right? So we're in a trauma response. Our sympathetic nervous system is ready to fight, flight, freeze, fawn, ping, 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 pong, pong, pong. I'm fighting, I'm crying, I'm picking on you, I'm judging you outwardly and inwardly. All this is happening. First, I want to name when I think about, okay, what can we do? I really want to be clear that in the space and time in which this is all unfolding, that of course, what is always there with us is our class, our educational level, our socioeconomic status, our sexual orientation, our gender expression, our race, our religion, and how those are perceived by others in the space. So as a white, cisgendered, queer woman, I am now going to say what I'm going to say, given that this is my experience also with my educational level and my socioeconomic status. This is the perspective I'm coming from. So I want to be clear on that. Don't go at it alone. You are allowed to clue people in. When we need to go to these things alone, because those times are with us, it happens, we need to go alone. What we are allowed to do is say, just so you know, I'm going to cry. And I just cry a lot. And I'm going to cry through all of this. And I need you to know that. And so there's the person that just needs to cry, or I snap back and I get sarcastic. And that's because of my trauma and what I've experienced with the healthcare system. It really doesn't have to do with you. We can clue people in. It might be the PT. It might be the assistant that's setting up the exam. It might be the physician. It might be the surgeon. It might be the anesthesiologist, whoever it is, the nurse, anyone along the way, the person that is pushing your wheelchair. I just cry and I'm going to be crying. Right? And so knowing how we respond can allow for us to access some bit of agency in these situations where part of the system has to be set up. It is believed that it has to be set up where it usurps some level of our agency and it's taken away from us. But we can be in a situation where we can extend loving kindness to ourselves. Like you talked about, BJ, my nervous system is going to start to take care of me. And I know that. So it's going to kick in here at any moment. And it's going to start to take care of me. I can let those around me. If I do have someone else with me, I'm going to start fighting real quick with a person. And here's what I want you to do when you see me start fighting. And it doesn't have to be, Natalie, stop fighting. It doesn't have to be. It can be put one hand on my thigh, right? I don't actually, and so I know even fighting, that's really delicate for people in different situations in terms of feeling safe in spaces, but it might even be fighting with a loved one that is with us, right? So I might start fighting with you and picking on you so that I don't start fighting with the doctor and I can maintain a safe relationship with them. So crying, extending loving kindness, even if through the entire appointment, you put your hand on your heart and just tap yourself, if you rub your thighs the whole time, or however many people you can clue in along the way and say, I just get a little short when I snap back at you. This is all just very typical for me.
That's beautiful coaching right there, Natalie. I think you're on the, it's lovely listening to you because I hear the fallout of you accepting and honoring what your nervous system is doing. Then from there, you've turned that into something lovable and honor and something to honor, not avoid or somehow upend. And then once you're there, it's just a hop skip to saying, hey, this is me, how it works. This is how I'll go without shame. And it's such a beautiful, you're just modeling so much for us here. And beyond simply just the inversion or the inflection of our bodies taking care of ourselves, but naming the cascade that can happen once you've done that. And then how you can start communicating that to others. And boy, I would imagine for you too, as a provider, if someone said those things to me, kind of, hey, heads up, when we do, well, I would be so, not only I'd be so happy to hear that, it would be so helpful for me to hear that. And that patient would be doing their part to make a therapeutic relationship with me. So there's so many reasons I would love, love, love to hear patients or others say that to me. So not only is it okay to say, it's very welcome to say and can really shift the experience for everybody involved, provider included. So you are awesome, Natalie. Thank you. It's beautiful. Well, should we cut to the beautiful audience?
Please, please, please.
Okay, Sones, what's going on out there?
Yeah. While you're closing the slides, we got a couple of questions.
Oh,
This person said, I think it's useful to distinguish between fear arising and trauma. I'm interested to hear what BJ and Natalie think about this and if they think there's a distinction. Example, I can be afraid of medical experiences, but that doesn't mean to me that there's trauma in all of them.
My first thought is, dear, dear human, you feel scared. And that's why I actually didn't want to spend a lot of time on the trauma. I don't diagnose people and I don't have the ability to, I'm not licensed to. I'm with you. I too can't always clearly determine trauma. And what you sound so clear in is that you are scared. You're scared. And so then what happens when you're scared? So then with curiosity and an open mind of, ooh, how do I respond when I get scared? For me, I start to get mad. Right. So then once I know I'm mad, once I'm really mad, I'm like, ooh, I sometimes try to lift up and see, ooh, I'm actually scared. So for you, I think about, I don't know, in terms of trauma, fear, often the fear in terms of having interventions within the healthcare system stems from, I've had this done before and it hurt really bad and I'm scared it's going to hurt that much again. And so what do I need? I've noticed it. I've named it. How can I create a ritual, a routine around this if it's something I have to do often? And again, access some level of agency, which might mean, okay, I'm actually just going to let myself cry. Because when I start to cry, I feel less scared because it's not stuck in me. And I'm going to tell a person, I'm going to just cry. I'm going to let it out because I feel so scared. And then you have company. And when we have company at baseline, oftentimes true company, we feel less scared.
yeah, that's right. I have nothing to add necessarily except to just say whether the language of trauma, and back to Natalie's hesitation of bringing that into the conversation too much, we can name it as trauma, we can name it as fear. There are different ways to understand this process. So I don't want to get hung up on the language per se as much as the phenomenon. So, what else is going on?
Yeah, Deborah, you have had your hand up. You may have to unmute on your end.
Hi, Sonia.
Hey,
I'm
Deborah.
so grateful. I was really intrigued already at the outset to hear Natalie's experience of just sorry to say, I'm going to put in air quotes, just a tender ankle. And what it reminds me of is how a slight insult to our physical vessels, let's call them, is actually perceived by, and this is, I'm so fascinated by this, is perceived by our, I call it a snake brain, by our endocrine system as a mortal threat, I believe. And I just find it so interesting to be having this discussion. I'm looking forward to learning more about the endocrine system, and like Deepak Chopra has brought up in his Quantum Body, which I haven't read yet, the idea of metabolizing experiences and how we can optimize our well-being by having awareness around that. But I did want to just say my own personal experience of this the first time was I had a newborn and I had to travel with him when he was 4 days old, and I was going up Pacific Coast Highway from Los Angeles through Malibu to Santa Barbara. And it sounds lovely, and it was beautiful. Everything was well, all was well. But what I noticed is the road dividers were, when I was going past them, they seemed to be coming at me.
Mm.
And as if that there was something coming towards me in attack. And I was like, that's so weird. Normally, I'm the one flying forward, but I felt like in my postpartum hormonal state, my brain was perceiving this attack, or something coming towards me rather than me going forward. I just thought that was very interesting. And the last thing I'll say is, my go-to is like an anti-prostaglandin, because I really think that it's interesting that if you have a dose of Advil or Tylenol, it sort of just takes that response down so that you can have some rational dialogue with yourself, at least.
Mm.
And so I really deeply appreciate this. Thank you, Metal. Thank you. And that's all I want to say.
Thanks, Deborah.
Deborah, thank you for bringing up this idea of mortal wound. And I love that you put like just my tender ankle in air quotes. I love you brought this up and I meant to mention it. Something that I think a lot about in my work and that I have the opportunity to speak with folks about is the all or nothing thinking and how we get really black and white. And so that like my tender ankle, did I have the thought, I'm never going to be able to go for a walk again without pain? Absolutely. Did I think that for multiple days? Absolutely. So the black or white thinking, the all or nothing engagement is again, a nervous system response that is really typical and real, and that we can back up and notice its presence and existence. And again, even going back to the first person that shared, to name the fear and notice it and love on it and be super kind.
Thanks. All right. Quick question for BJ and Natalie. We've got a few hands up, so I just want to preemptively ask if you can go a little bit over time. Okay,
Yes.
wonderful. All right. So we got another question. This person said, I have ALS and have been given all sorts of free medical advice from friends. The one that pushes my buttons was that if I think the right thoughts and if I think and I imagine that I can walk, I will get better. What are your thoughts to this approach?
Someone's comfort is more important than your reality.
I'm with you as a default statement there, Natalie. I agree as a general rule. And I think that I'll offer a slight counterpoint too, which remembering that, and this is probably something of a response to my dear father's comment in the chat, that about this being about the mind-body connection, and we've spent a fair amount of time on trauma and hard emotions because those make the point and they're common. They make the point about this connection. So that's one statement. But another true is there is something because of this mind-body connection. There's action flowing between our thoughts and our feelings. And it's not untrue that a positive attitude per se, when genuine, I would add, not forced or faked, that things can flow from that. Feelings can flow from that. So it's not, so we'd otherwise be hypocritical if we said thinking positive wasn't effective. It can be helpful as a force. It has its limits. We can't just command our body to do certain things. But I will circle back to my qualifier for that think positive idea, that positive attitude idea. It really matters if it's honest and genuine. If you're plastering a smile on your face to be positive and you're inside screaming, I'm sorry, that's not going to help. That toxic positivity. Then you are just increasing the gap between the divide within yourself. And that's where more trouble comes. So there's some nuance in here. I hope that it comes across. some thoughts.
Thanks. Okay, we got quite a few hands. Vito, may have to unmute yourself on your end. I'm also wondering if Vito's just had his hand up for a while and is maybe on later.
Can you, Vito?
Hi.
Oh, hi.
Hi. I've been to a few. Well, first, hello to Natalie. Hello to BJ. Hello to Sonia. I've been to a few webinars. They've been very helpful, and this is the first one I almost cut out of. It was a bit much because what Natalie described is precisely what I was going to talk about, and it really put me there. I was 18 years old. I just bought my own house. I was always very independent, and I woke up one morning and started deeply crying over a memory that I had shoved down, which was being tortured by a dark triad sibling who was 5 years older than me. He was sitting, and he would do this with some frequency. He was sitting on my chest to where I couldn't expand my lungs and I couldn't breathe. And he would take me to the point where, this is really sick stuff, he would take me to the point where I'd almost pass out, and he was enjoying it. And dark triad people, their way of self-soothing is to inflict cruelty on another human being. Unfortunately, I was in the wrong place at the wrong time. And it's just fascinating. It's upsetting, but it's fascinating that my spirit chose, when I had bought a house, I was away from those people. And the most traumatic part about it was I had, I don't know if I should say mother, I had a female parent who was right there. And I'm screaming to her, I can't breathe, I can't breathe, I can't breathe. And she's ironing and she doesn't even look up. And she says to the older sibling, stop doing that. And there was something, even as a boy, there was something in me that I could feel her, let somebody else be a victim for once. This had to do with her marriage. Let someone else be tortured for once. And that, a child can't process that, right? A child is like, I have no safety. Someone could literally be in the process of taking away my breath, and someone whose fantasy is she's my mother doesn't care. And that really reminded me of, unfortunately, what Natalie went through, which is, hello, you just operated on my heart, extreme pain. Am I even, I'm in the room. Do you even know I'm here? And that's just so soul crushing. And it's the very first webinar I ever attended. It was like, okay, I have just another human being hear this is just so, it's so healing to finally tell someone. I remember attempting, I don't know, Natalie, if you've gone through this, but I remember attempting to tell some people of what happened, and I get stories. It's like a nightmare scenario. I get stories of like, well one time my brother he borrowed my favorite sweater and he stretched it out, and it was right before prom, and he just like, do you understand the scale of difference between what we're talking about? Like, I don't know if you've gone through someone, one time I went to the doctor and he told me I had high blood pressure and I didn't, it's just like, excuse me. So to have a place where I can say this, and it's just, I want this to come out right. I'm hardly happy that Natalie went through what he went through, or that BJ went through what he went through. You're sitting there, hello, you opened up my leg twice and you didn't need to, and you're not acknowledging that. And I never got any acknowledgement from my female parent, but it's just, it's great to have someone to hear this. But the second part of it is, you're talking about the nervous system. I feel like there was a wisdom to the nervous system because I couldn't handle it in the moment. I had to dissociate that. And my spirit decided, all right, you're a man now, you're on your own. you have a job, you own your own home. You can feel this pain. There was nothing conscious about it, right? It was suddenly like it was fairly early in the morning. I woke up probably, still halfway in a dream state, and all of this came. And it was the only time I ever cried this much was when my animal companion died, or even probably also when my father died. But it was just these things, they are a part of you. I feel like they can also be healed, but just thank you for having this webinar.
Vito, thank you, buddy, for showing up as you do here and your honesty and that note about and how these even conversations like this, some with some safety in them, can be triggering, can be re-traumatizing to some degree too. So thank you for hanging there with us, Vito, and sharing it again with us. You always make the point so beautifully. Yeah.
Thanks,
you.
Vito.
Yeah.
All right, Deb, you've had your hand up for a while.
Hi, I'm not sure if this is a great timing to say what I was going to say because of what Vito just just said. So I just want to pause for a moment and before I launch in a little bit different direction. So yeah. So yeah, where I was going, like I say, is a little bit different direction. And I guess I just wanted to bring in, that there's so many maps in the world now of how to, there's so much about the mind-body connection. And you all have focused on trauma and fight, flight, and fawn, those kinds of responses. But I wanted to bring in the map that is most helpful for me, actually, in terms of the mind-body connection, is actually TCM, the 5 elements, and realizing that that not only does the emotion impact the body, but the body impacts our emotions. So if someone has lung cancer, they're going to have a propensity to, in that map, be more sad. They're going to be more inclined to be crying. If somebody has something going on with their kidneys, they're going to have more fear within that map, which from my experience, I worked with a Chinese Qigong master in the 1980s. And so I've taught Qigong and done Qigong since then. So it's so ingrained within me. And then, of course, on that map, on top of every organ being associated and meridian being associated with an emotional aspect and a vulnerability, it's also associated with an element on the earth. So, so there's real prescriptive kind of places to go. If you're having the kidney issues and feeling fear, then water is being near a body of water or drinking water, or lungs with that kind of fear, breathing more deeply, those, not fear, sadness with the lungs. So I just wanted to bring in too that especially, and since you're talking so much about going into doctor's offices, that for me, it really helps me to realize where I'm going to be vulnerable, even aside from a trauma or past experiences or things that have happened. I'm already vulnerable when I walk in because of what's going on in my body. And if I know that area and know this map, I can work at it in other ways to support my body rather than just specifically through holding my emotions, which is extremely beautiful. So I'm not trying to say anything apart. I'm adding to and saying amen to all of what you say, but just adding in that we have so much to empower ourselves in terms of supporting our bodies that actually strengthen our emotions. So I just add that map on top of your beautiful map too. So thank you for listening.
Thank you, Deb.
Thanks, Deb.
Thank you, Deb. Right on.
There's some good thoughts. Okay. Yulia, you've had your hand up for a while, and I apologize if I'm mispronouncing your name. Please let me know when you're unmuted. Yulia, you there? Okay. Yulia, I'm just gonna mute you for the moment and then head to someone else. Lisa, you're there and have a question. Okay, gonna do this one more time. Go to Esther. Esther, you there?
Yeah, I'm here. I was
Hi,
just
Esther.
about to bounce, but hey, once again, thank you guys for this. So many thoughts and ideas and really stimulating conversation. So much appreciated. I wanted to just offer a little bit around all of the nuance that one of the things it seems is that there's a lot of nuance to this conversation in terms of trauma and what is it, and the first comment made me think about the idea that there's an event, and I loved what you said, Natalie, about a surprise when we as a whole being
Yes.
Receive a surprise, that there's affect. So, one way maybe to think about it or to add to the conversation is that an event is an event, and then there's a response, and then maybe what comes after might be trauma.
Mm-hmm.
A little bit, depending on, there's so many factors that go into how we might respond, and how our nervous system's wired, and what our history is, and what our culture is, and so on and so forth. We're kind of in this, our own centers of this concentric circle, in a way. So I was just thinking about that a little bit. And then I loved that mortal threat. And also I think you kind of were touching, Natalie, on moral injury. The idea that when, that kind of comes into the conversation, that when we are at odds with something that goes against our own sense of morality or ethic, that brings up conflict, and maybe not even conflict, but that can cause, as we're going to have a mentor who works a lot with grief and loss, and people that have heavy grief and loss, and so people that would be diagnosed, if you will, I have my finger air quotes up for some reason, but diagnosed with PTSD. And her sense is that sometimes people are suffering from a real conflict of moral injury, and it's presenting in all kinds of ways. So I just thought it was interesting that it came into the conversation. Mm-hmm. And then, yeah, just want to speak a little bit to the person who has ALS, and also the slide around just think positive, and how we sometimes, I think, say those sorts of things to other folks out of our own sense of discomfort or fear or whatever's going on with our own, maybe fight, flight, freeze, or nervous system, or our own history. That also seems to me that sometimes those comments also come out of a pretty individualistic point of view, that the onus is on us individually always to solve our own thing.
Yep.
And that can be pretty hard. Yeah, it can be a pretty hard thing. So just blessings and support to whoever it was that is kind of going through that journey. And it's not our fault that we get sick and injured. It's not you know, we are in community and we're hardwired to be in connection with others and in community. And then I guess lastly to that, just briefly, you talking about the think positively again slide, for whatever reason, for me, it brought up, I was thinking a little bit about moving of energy, and it brought up an experience I had taking my daughter to the dentist one time. She was only about 8, and she was getting a filling, and the dentist froze her, and he started to work, and he started to drill, and she was saying, I can't, it hurts. And so I was with her, and he kind of dismissed it, and I was sitting there with her, holding her hand and going, okay, like, please, we need to stop. And he said, no, she's frozen. And he took the tool, like the digger tool, and he started jabbing it into her gums. And I remember sitting there and looking at her, and it was like, yeah, I went into essentially kind of a freeze, or maybe what I would call an orient. And I just held her hand and I went, okay, like, you're just going to look at mom and we're going to breathe, because there's my kid on the table with this man who's got a tool in his hand, and he's just going to do the thing no matter what is happening. And for me, it was pretty horrible. And then for me, what was helpful was that even in the moment, I didn't stop it. But after the fact, I was able to do, I called the clinic and I had a conversation about it. And for me, that was some kind of moving of energy through. I was able to take some action, which seems somehow valuable, if that makes sense. So yeah, thank you again. Those are just some things to throw into the pot, along with a million other thoughts. But, always stimulating.
Thanks, Esther.
Thanks, Esther, as always.
All right, I'm going to try one more time with Yulia. Yulia, you there?
Bonjour, BG.
Hi there.
Here, Sonia and Natalie.
Hi.
Thank you so much. Hello. Thank you so much for a beautiful presentation. I'm Yulia. Sometimes we put a lot of effort to change our life, but when it happens in an instant, we are not prepared. Maybe our instincts did not stop us from doing something, and we face a shock, pain, self-blame, loneliness. Loneliness because we should undergo our experience on our own. For myself, pain came to create a hole what love failed. It's not about being with someone. Some relationships are created for love, some are for divorce. Pain, je sais pas, it's absolute. We cannot ignore it. And it's funny, what we lost hurts us more than what we had. We have to adjust a lot. In my case, when I became partially blind when I was 36, I learned to walk with a cane and wear dark glasses day and night. And you think you did your best, but society will still put a cliché on you, being ignorant or tolerant. Halfway, I realized my body and mind are not enough. Body is still struggling with pain, and mind is limited to my reactions and my past. When I realized that that was my personal, peut-être checkmate, and in absence of something we can discover it, for me that was my new sensations, nature, intuition, never mind how we call you inner truth. I have one question to you, BJ. When we face significant challenges in our life, there is always kind of support we do not receive from others. And we have to create it ourselves. What was that for you? If you may share, of course.
Yeah, thank you, Yulia. That's a big question I'll be thinking about after we hang up today. I suppose on some level, one of the things that I was doing often, and still do, is generalize from my own experience. I didn't want to end up hating people because they didn't know what to say to me, or something. Hate's the wrong word. I knew I could just take the bait of being different or being special. No one understands me, and I could just take that bait, and off I'd go. It might feel even good in the short term, but I think I could have sensed that was a dead end, a kind of a cul-de-sac way of being. So for me, a fair amount of the work that was by myself was done just inside, was generalizing from my experience, seeing my injuries as variations on themes that everyone experiences. That allowed me to not separate myself from the rest of the world or take the bait to do so. And then from there too, I could generalize and say how unprepared I was for my own experiences and how lost I was with my own experiences, and extend that to create a stew of forgiveness, in a sense, of yourself and others all the time. Because otherwise I would have been whipped around much more by the reactions of others. And sometimes the reactions of others were so plainly hurtful. So for me, that's something of an answer to your question, Yulia. It's just the first thing that came to mind, is that sort of coming up with a worldview in which I belonged, but so did everyone else around me, and including all their wayward responses, or what I was perceiving as wayward. I kept looking for a worldview that could hold all of those things. And that was very helpful. And I didn't have to leave the world or take the bait that I was different in some important way. So anyway, that's a thought. But like I said, Yulia, I'll be thinking about this one for a while. Thank you for bringing it up.
Wow, thanks, you two. That was lovely. We are over time. Thank you so much for staying over. Everyone who's still out there in the room, and you two as well. Wishing everyone a great weekend. This is our last webinar of 2023, so we'll be thinking of you in the new year as well. Thanks, everyone.
Thanks, guys. Thank you, folks. Thank you, everyone. Thank you, Natalie. It's really a pleasure being with you. I learned so much from you.
Thanks, BJ. Thanks, Sonia.
Happy
Thank
weekend,
you all.
everyone. Bye.
Bye.